Hi, I'm Dr. Rajani. Thanks for joining me today. Now, the under eye, you may be seeing a bit of bagginess under the eye, maybe what we call a malar fat pad, a little fat pad at the edge of the cheek, or a nasojugal groove, a groove between the fat pads that runs a little lower than those two. Now, there's a lot of solutions. People try tea bags and ice and different things to make it go away, home remedies, lymphatic drainage. I'm talking to you about lymphatics a little bit more today as well, but sometimes they just don't cut it. You need a little bit more, and you think, should be an easy solution. Let's put a little filler in there. Today I'm talking about filler and baggy under eyes after filler, and one of the reasons many people don't think of as to why it happens, what the solution might be, and why maybe you went into your practitioner and they said, hey, you know what? I'm not going to put filler underneath your eye. Why would that be? If you like these videos, click the like button now. I'll bring you more, but I talk about the under eye quite a bit. The reason is it's very complex, some of the thinnest skin in the body, but when you put filler in there, it causes a lot of issues. Let's look at a slide so you understand the first thing we think about before filling it, and that is the retaining ligaments. So the first thing is you notice the zygomatic cutaneous ligament. That's the floor of where we put the filler. If you look at then the orbicularis retaining ligament, that's kind of the ceiling of where we place the filler. Medially, it's the tear trough ligament. So that's what we're thinking in our mind, but here comes the problem. And back in 2007, I worked with an oculoplastic surgeon, and he would remove the excess fat under the skin after filler because of the lymphatic problems that it caused. And remember, back then, we didn't just fill and then dissolve like we did today. We were a little more scared of dissolver. We maybe put it in once, but then we wouldn't add more. Today, we're much more liberal with dissolver, but here's the reason why a lot of people get a baggy under eye. Let's look at the lymphatics. If we look here outlined in green, we have the deep lateral channel, but look at this. That's not as important as the superficial lateral channel, and this is the one we often get. Why? People put fillers in, sometimes we put a deep layer, but to get that punch, to use the G prime or the force of the filler to actually lift, we come out often with a cannula and we'll put it superficially. It's key to have a product that integrates well with the tissue, doesn't cause compression or draw water in. And that's the reason we saw it in 2007. When the filler we used before that time worked so well for the tear troughs, one came in 2007 that drew a lot of water in. We've used it the same way. It didn't take but a few patients till we realized that was a disaster. And if you look here, it's that superficial lateral channel and sometimes branches of the medial channel because you're trying to fill the medial tear trough, and it stopped the lymphatic flow and you get congestion. Now, if you're a person that gets puffy eyes, it waxes and wanes, I'm not talking about allergies, but from day to day otherwise, that's a sign you might have lymphatic problems to begin with. And if that's the case, the last thing you want to do is then add filler to an already compromised area. So if this were to happen, what do? Number one is we dissolve. Because dissolver works, I know there's people that talk about dissolving disasters, dissolving their own hyaluronic acid, but honestly, I use thousands of units in the run of a month. It works well. I don't see problems with it. You're always going to have esoteric cases of everything, but it's few and far between because over 20 years of doing this, I haven't seen a long-term problem from it, and it's used commonly as a dispersant. So number one is you can dissolve it. If there's a filler with a lot of cross-linking, sometimes you need several dissolving sessions and you need to know what dose to use. You can also massage the area and you can use other treatments to fill like platelet-rich fibrin gel. You can also use devices and lasers sometimes if appropriate, but that's less commonly so. RF microneedling for those who really know how to use their device. So the answer is maybe avoiding filler or judicious use of the fillers. But knowing these retaining ligaments, knowing where the lymphatic drainage typically runs, because there's always aberrancies, is really important to get a great outcome. Understand, many practitioners do not fill the under eye, and they have a happier life for doing so because they see less complications back. But if you know how to deal with the complications, if you do enough, you will see people that do have this baggy under eye after filler, and you need to know how to deal with it. Lymphatics is something we talked about a long time ago, and there's a resurgence of it now with the increase in the new availability of facial fillers that are FDA approved for the cheek, and that brings a surge of social media, of awareness, and desires to have that filled. Remember, doing these procedures is an option. Nothing's needed, it's a choice. And if you choose to do it, pick a practitioner that does a lot of them and knows how to deal with the complications, but be aware of the lymphatics. I put a complete playlist up here for hyaluronic acid fillers. Stay tuned, keep your skin and body beautiful, healthy, and vibrant.